Now, when we do have a BPH, now as we grow and we do have BPH, what happens? So when you look at the slide, the picture on the left side, we have the normal flow. You see the bladder is full, and when is the time for you to urinate? When you feel the urge, you go and you start urinating, and guess what? The urine flows freely, nicely, smoothly, with no issues, and it's out. You empty your bladder, and then you move on. I always say this, unless you've not been, maybe most of us here grew in Ghana. I don't know where, but in when we were kids, we used to have this challenge who will be able to pee high into the sky, and then you see you can pee up, and the stream goes up and down. I don't know your age, but if you are 50 and above, try that and see if this what happens. On the right side is a restricted flow. So you see that the enlarged prostate has caused the urethra to be narrow, and therefore making it highly resistant for the urine to pass through easily and smoothly. So that is what the BPH does. It narrows the urethra, and in that case, causes a resistance for the outflow of urine. So what do we see as men when we are growing? What do we see when we do have this prostate enlargement? So on the right side is the symptoms that we see. We have the storage symptoms, the voiding, and the post-maturation. I will slowly go through it. Urgency is defined as the urge to go. I mean, you just feel like the urge to go, and at times you cannot even hold yourself. That's urgency, the urge to go. Frequency, that's urinating very often, because when you urinate, when you go and you pee, you don't empty your bladder well, so in no time, the bladder will fill up again, the muscles will contract and tell you need to go. So frequency is also a symptom. Frequency can also be symptoms of other diseases, like diabetes and others. So all these symptoms and signs that we're talking about is for us to remember that if we're experiencing these symptoms, it's not normal, and we should go see our doctor. Nocturia, that's urinating at night, getting up and urinating multiple times at night. That's also can be caused by BPH. And incontinence, that's you cannot stop your urine from coming. At times when we were growing up, we could hold the urine for hours and hours. At times, in some our age, and I don't know, most people also older than me, you don't want to try that. So I had I was talking to a group of men, and they were talking about having long trips in the United States, and you realize that when